Hey everybody, my name is Josh and I study blood flow restriction training. And the goal of these videos is to make blood flow restriction training easy for you so you can better understand it and you can better apply it in practice. Now in this video I want to get into just who is blood flow restriction training useful for. Now by now we have a good understanding of what blood flow restriction training is, right? It involves the restriction of blood to a working muscle. Okay, while that working muscle is doing some kind of training, like usually that's resistance training or lifting weights. And if I do this, if I restrict blood flow to a working muscle, all I really need to do is lift light weights in order to see improvements in my muscle mass and muscle strength. And the literature is pretty clear on just how much of an improvement we see after doing this. Okay, it turns out that if I do blood flow restriction training with light weights, the improvements I get in my muscle are very similar to the improvements I get into my muscle after doing traditional heavyweight exercise. So you may be wondering, well, if the benefit is the same, why would I ever bother doing blood flow restriction training? Okay, who is blood flow restriction training actually useful for? Well, it's useful for those who cannot or should not lift heavy weights. Okay, maybe a person has chronic pain. Maybe a person is frail and they just can't tolerate lifting heavy weights. Well, maybe they still want to see improvements in their muscle size and muscle strength. Well, what can they do? Well, they can opt for light weights, combine it with blood flow restriction to still see those improvements in the muscle. Now, one of the best uses of blood flow restriction training is in those people just after an injury. Okay? Now, let me walk you through this by using an example. Okay, let's use the example of an ACL injury and reconstructive surgery. Because after a person has an ACL injury in surgery, the surgeon often tells the patient they cannot put much weight through their knee. Okay, it could be many weeks, up to 10 weeks where a person cannot put much weight up through their knee. Now, if a person can't put weight on their knee, they really can't do any meaningful leg exercises. And if a person can't really do any meaningful leg exercises for that long, well, they're going to be very susceptible to losing their muscle size and muscle strength. Okay? There's nothing wrong with their muscles, but while they're waiting for their knee to heal, oftentimes after an ACL injury, people experience losses in their muscle. And this is not ideal, right? Because this is going to prolong the recovery. This is going to prolong how long it takes an athlete after an ACL injury to get back to the field, get back to the court. Because once finally their knee's healed, now they have to take even more weeks to regain that muscle size and strength that they lost during that time they're waiting for it to heal. Now this is where blood flow restriction training comes in though. Because what blood flow restriction training offers, it offers a person the ability to do meaningful exercise in their leg while they're waiting for that knee to heal. Remember what blood flow restriction training allows a person to do. It allows a person to do only light weights and still get a good meaningful stimulus and meaningful adaptation in the muscle. Okay, so a person after an ACL injury who can only really do really light exercises, and those light exercises on their own probably aren't going to do anything. They're not enough of a stimulus to cause any adaptation in the muscle. So that's going to cause the muscle to be lost. Well, what a person can do is combine those light leg exercises with blood flow restriction. Now when they restrict blood flow while they're doing the exercises, now they can get a meaningful stimulus and a meaningful adaptation in the muscle. And this is going to help that patient avoid the muscle losses while they're waiting for that knee to heal. It's a very good use of blood flow restriction training. Okay, the application of blood flow restriction to very, very light exercises after an injury. This is going to help the patient avoid the losses in the muscle while they're waiting for that knee to heal, that joint to heal, that tendon to heal. Okay? But this doesn't stop at injury, right? Blood flow restriction training, as I said earlier, is useful for anyone who cannot or should not do high-weighted exercises. Not only after injury, but after perhaps a person with osteoarthritis, right? People with osteoarthritis often struggle with pain during heavy weighted exercise. Well, a person can, if they struggle with this, can opt for light weights, combine it with blood flow restriction to still see improvements in the muscle. Okay, that is who blood flow restriction training is really useful for.